Hi everyone, I am Dr. S.Nagendra Boopathy, interventional cardiologist working in the Sri Ramachandra Medical Center, Chennai. I am going to discuss about a procedure called as rotablation, where we utilize an olive-shaped burr which is shown in the figure with diamond spicules attached in front of it. This olive-shaped burr is introduced into the coronary artery which is calcified at a very high speed utilizing a gas called as nitrogen. At high speed, these diamond spicules cut the calcium into very minute small particles and they go into the distal circulation, ultimately entering into the lungs that will be scavenged by our circulating white blood cells. This procedure is very important because after rotablation, this makes us the interventional cardiologist to deliver the stent easily across the lesion. It also helps to make the stent expand in a better way. More stent expansion leads to more luminal gain. More luminal gain leads to more blood flow to the distal myocardium. Whenever more blood reaches the distal myocardium, ultimately it improves the quality of life of the patient. It also improves the survival of selected patients in specific arterial segments also. Such procedure is commonly performed safely these days and it can also be performed effectively in many centers across India. I am going to discuss about one such patient in whom we have performed this procedure almost a couple of years before. This particular patient is a middle-aged male who had an attempted failed angioplasty to the right coronary artery mid portion. You can appreciate a significant lesion in the mid right coronary artery. He had an MI 4 weeks before when they attempted this particular angioplasty. Lot of devices are available these days to tackle such situations, but one commonly and cost effective equipment is rotablation. Before this procedure, we take the angiogram in multiple angles to assess the extent and distribution of the calcium and also assess how safely we can perform this procedure. In this particular video, you can appreciate an olive shaped burr that is going from the origin of the right coronary artery across the lesion into the distal portion of the right coronary artery. It is not just introduced into the right coronary artery, it is introduced at a very high rotational speed that leads to ablation of the calcium, and such ablated calcium enters into the distal circulation, ultimately as I told before enters into the lung and where they will be scavenged by the circulating white blood cells. After this particular rotablation procedure, we were able to deliver a balloon and ultimately deploy our drug-eluting stent in this particular patient. That leads to better luminal gain. It is easily appreciated. In spite of good appreciation with an angiogram, we also ensured that we do an imaging in this particular patient utilizing optical coherence tomography, where a light waves are introduced into the coronary artery to assess the stent expansion, and it is also used to assess identify any kind of complication that might have been produced during the procedure. This particular OCT showed a very well expanded stent with no distal complication or proximal complications. Thanks for watching this video. This is Dr. S. Nagendra Boopathy again. Thank you.